thanks so much for coming out. All I want you to know is that we're telling the super committee hands off Social Security, Medicare, and Medicaid, period. No exception. And we've made that clear over and over again. And I'm going to now ask Rosa DeLauro of Connecticut.
We know what we have to do. We have to put America back to work. That is the way in which we reduce the deficit. We have to do what's right by the American people, by our seniors and our workers. They've given a lifetime of hard work, and they deserve a dignified retirement. And I will tell you, my mother is going to be 98 years old in December. And when I think about these programs, I think about what her life is all about. What happens when you tamper with Social Security and with Medicare? We all want to deal with the issue of the deficit, but what we want is a balanced approach. We do not want to place that burden on our seniors, on our middle class, and the most vulnerable in our society. We should stand up for the middle class and the vital programs that help to form it, and that is Social Security, Medicare, and Medicaid. You want to start what we need to do on deficit reduction? Let's go to the oil companies and their subsidies. Let's go to the multinational corporations who are taking our jobs overseas. Big agriculture, not our small farms. Let's make it possible for our seniors and middle-class families to be able to take care of Social Security, Medicare, and Medicaid.
Rosa DeLauro! Now, 9 months in the Congress. David Cicilline, Rhode Island. Welcome him. New guy. Best new senior citizen.
Thank you, Mr. Conyers, for bringing us together, and I'm thrilled to be here today to join my colleagues as we ask the Joint Select Committee on Deficit Reduction to do its job in protecting Medicare, Medicaid, and Social Security. We are just a few weeks away from the plan being submitted to the Congress to put our country on solid financial footing. And it's critical that in doing so we protect our vital safety net programs like Medicare, Medicaid, and Social Security. These programs were created because they reflect our values as a country. And we should be incredibly proud of these programs and have to do everything that we can to ensure that we live up to their promise, that the benefits earned over a lifetime of hard work will provide retirement security to our seniors. I meet with seniors all throughout my district all the time and understand that they are struggling to make ends meet, especially when faced with the ever-growing costs of health care, prescription drugs, and housing. Seniors like Rita Manley in my district, who's from Central Falls, Rhode Island, who relies on Social Security for her income and Medicare to cover her medication, which costs about $400 a month. She would not be able to afford her cancer medication without the support of Medicare. We have to protect the economic security of all Americans, but it should not be on the backs of our most vulnerable, especially people like Rita and the millions of Americans like her all across this country. We must not ask seniors to sacrifice benefits or for asking millionaires and billionaires and America's largest corporations to pay their fair share. Instead, the Super Committee must develop a plan that grows our economy and creates jobs in America.
Cicilline! Jan Schakowsky, Chicago.
I am so proud to be here with Congressman Jan Conyers and all my colleagues and all of the wonderful supporters who believe that, like I do, that the Joint Select Committee on Deficit Reduction should not reduce benefits for Social Security, Medicare, and Medicaid recipients. Those programs are simply not to blame for our economic problems, and cutting those benefits would put the fiscal and physical health of our seniors and individuals with disabilities at risk. Nearly 55 million Americans rely on Social Security, and benefits are modest. The average benefit is $14,000, $12,000 for women. The top 10, the lowest income, 10% of seniors rely on Social Security for 100% of their income. And most seniors rely on Social Security for most of their income. Those benefits are precious. They keep 13 million seniors out of poverty. So 47 million seniors and people with disabilities rely on Medicare. Again, these benefits are modest but essential. And 68 million Americans rely on Medicaid for everything from prenatal care to long-term care. As co-chairs of the Seniors Task Force, Congresswoman Doris Matsui and I were thinking about those Americans and their families when we sent a letter to the members of the committee requesting that they reject benefit cuts. And we were thinking of them when we co-sponsored Mr. Conyers' resolution. Like so many Americans, we reject proposals that ask 99% of Americans to sacrifice, while the top 1% of Americans is not required to contribute even 1 penny.
Thank you, Representative Conyers, for putting this event together. Everything's been said, but everybody up here hasn't said it yet. So this afternoon, I want to add my voice to the others here today to make the clear and unequivocal case for the protection of Medicaid, Medicare, and Social Security. You know, growing up, my parents taught me to believe that helping those in need was not just necessary, it really was a noble cause. That's how they lived their lives, and that's how I'm living mine. And few programs provide as much for those in need than Medicaid. It's an essential program that provides low-income Americans, including millions of children, with basic health coverage. And it works effectively and efficiently. When it comes to Social Security and Medicare, let's remember these aren't giveaways. Social Security and Medicare benefits have been earned by people who have worked decades into the system.
Thank you, John, for bringing this group of us together today. All America knows that the greatest legacy of our great Democratic President Franklin Delano Roosevelt was the Social Security program. When Social Security was created, 90% of senior citizens lived in poverty. Now, fewer than 10% live in poverty. It has been the greatest anti-poverty program that this nation has produced. All America knows that the Medicare and Medicaid program were the greatest legacy of the Johnson administration, Lyndon Johnson's years in office. And those as well, along with Social Security, are the absolute core of our safety net for our citizenry who are in need. So these should not be a part of the deficit reduction program. They should be off the table and not a part of the dealings of the super committee.
The super committee must not look to Medicare, Medicaid, or Social Security for cuts. We must not balance the budget on the backs of those who can least afford it. Many of us will oppose any proposal that comes from the super committee that has any cuts in Social Security, Medicare, or Medicaid. The top 1% of people in this country are making by far the greatest percent of the economy that they have ever. They're being taxed less than they have historically. And if we have to deal with the deficit, that's where it should be dealt with, in taxes on people making hundreds of thousands, millions of dollars, billions of dollars a year.
That's right.
Mr. Buffett has the right idea, and we should not use this economic crisis, and the crisis is joblessness. The debt is not as big a crisis as joblessness. We got to direct our attention to the joblessness, to increasing the economy. But if there are going to be cuts, not in the areas that people need it the most, that low-income people need it. Medicare, our seniors, Social Security, and Medicaid. Not a dime. Thank you.
Call your congressman and 2 senators and get them to sign up with us, all the organizations and individuals. I thank you so very much, and this will be continued when it's not raining. Thanks for everybody coming out.